So hello and welcome to the Smart Use Health Insurance Understanding and Estimating Healthcare Cost webinar. Smart Use is part of a multi-part series program designed to help you better understand how to take advantage of your essential health benefits, understand and estimate health cost, track the services you received, and keep records of both healthcare use and expenses. This session of the Smart Use series is designed to help you understand what you need to know about healthcare cost, know where to go for information about healthcare cost, and review strategies and use tools to help you estimate healthcare cost. The overall goal of this segment is that you will leave here knowing how to use your health insurance documents to determine healthcare cost. So, my name is Jesse Ketterman. I am with University of Maryland Extension. I'm a family and consumer science educator in Western Maryland, and my emphasis is personal finance and health insurance literacy, and I'm an accredited financial counselor. And I'll let Maria introduce herself today.
Well, thank you. So I am Maria Pippidis. I work with University of Delaware Cooperative Extension. I also am an extension educator in family and consumer sciences with a focus on financial management. And I too am an accredited financial counselor and financial fitness coach. So welcome, and I look forward to working with you all today.
And we are also joined by Lisa McCoy, who is running things behind the scenes for us. So she's going to be monitoring the chat box and answering questions that are posted in that area, or at least letting us know what those questions are, and just making sure everything runs smoothly behind the scenes. And Lisa is part of our health insurance literacy team and also joins us from Western Maryland. And so our plan today is to explore the types of healthcare cost and how to determine what your cost might be. And we all know that the cost of healthcare impact our financial and physical well-being. And so understanding these costs so you can effectively use health insurance as well as enhance your financial well-being are a key to being a smart user of health insurance. And as we begin, it'd be helpful to know what questions you may have about health insurance cost. Knowing some of the questions you have now will help us guide us through this workshop. Many of your questions may be addressed during the workshop. However, we may not be able to answer every question, and so if you let us know what you're seeking here at the beginning, that'll help us as we proceed. So, what questions do you have about healthcare cost and how to estimate healthcare cost? So, if you have a question, just kind of post it in the chat box, and just to give us an idea of what people are seeking today in terms of understanding and estimating healthcare costs. I've always had employee health insurance, but I'm about to go on Medicare with secondary. I'm trying to figure out how this will affect everything. Is it wise to get the lowest price health insurance with the highest deductible? So those are questions kind of we'll keep in mind as we move throughout our presentation today. How to determine healthcare costs for your retirement. Yep, good. And so as we developed our presentation today, we came up with key questions that we were going to try to answer. One is why, and the why question being, why do I need to understand and estimate healthcare costs? The what, that would be what kind of costs are there and what documents provide information that will help me estimate healthcare costs, and the how, and answering the question of how do I estimate my healthcare cost. And so in doing so, it'll make you a smart user of your health insurance. But before we get started, we're going to play a little game. We're going to call it, will you be a smart use health insurance millionaire? And we're going to focus on terms and seeing what you know in terms, health insurance terms, and we'll do it in the millionaire game format. So I'm going to give you a question and 4 answers, and then you can type what you think is the correct answer in the chat box. So our $1,000 question is, what is the amount that you must be paid for your health insurance plan, the amount that must be paid for your health insurance plan, you and your employer usually pay it monthly, quarterly, or yearly? And your options are copayment, out-of-pocket maximum, premium, and coinsurance. So in the chat box, tell me what you think the answer is. Yep. And we see you have a lot of C's, so absolutely, C is the correct answer. Now moving on to our $5,000 question. What is the amount you pay each time you visit the doctor, have lab work, or a diagnostic test? And your options are coinsurance, copayment, deductible, and receipt. I'm seeing a lot of B's. Copayment is the correct answer. Very good. Moving on to our $10,000 question. The amount you owe for healthcare services that your health insurance plan covers before your health insurance or plan begins to pay. And your options are coinsurance, copayment, deductible, and allowed amount. C's and deductible, absolutely correct. Correct.
I think we're working towards a bunch of millionaires here.
I know, I'm glad that check's coming from University of Delaware Cooperative Extension, right? The $50,000 question, your share of the cost of a covered healthcare service calculated as a % of the allowed amount for the service. Your options are coinsurance, copayment, allowed amount, and balance billing. And so correct A is correct, coinsurance. Our $250,000 question. The maximum amount paid to a provider and is used as a basis for covered healthcare services. This may be called eligible expense, payment allowance, or negotiated rate. And your options are allowed amount, deductible, coinsurance, and out-of-pocket maximum. Very good. We're looking at the allowed amount there. Absolutely. The $500,000 question. When a provider bills you for the difference between the provider's charge and the allowed amount, for example, if the provider's charge is $100 and the allowed amount is $70, the provider may bill you for the remaining $30. A preferred provider may not bill you for the additional amount of a covered service. And so that your options are out-of-pocket maximum, coinsurance, receipt, and balance billing. Let's see what we have here.
This is one of the tricky ones.
I see the responses are coming in a little slower here. And a couple no responses. Hey. So the correct answer here is D. That would be balance billing. So that's the difference between the provider's charge and the allowed amount. That the answer there is D, balance billing. Yeah. And now the big money question. For $1 million, premiums, copayments, coinsurance, and deductibles are all examples of receipts, out-of-pocket costs, flexible expenses, and unknown cost. What do you choose there? Yeah, quick responses there. B, out-of-pocket costs, right? And so understanding, as you start to try to understand health insurance costs, you need to understand the terms that go with the health insurance. And one of the resources that we provided on our consumer resource page on our health insurance website is a list of those common terms used in health insurance. So a little later, we'll be giving you a link with that information on it. And so what's your score? I think there was one question where we kind of stumped a couple people, but for the most part, everyone did very well. And like I said to Maria there a minute ago, the checks will come from University of Delaware Cooperative Extension. So contact Maria directly if you're a winner there. And I think I should mute her line so she can't respond to that. So now we're gonna turn to the question of why, and why do you need to understand and estimate healthcare cost. And so let's see if we can get a couple answers in the chat box there about why do you think you need to understand and estimate healthcare cost. So let's see if we can get a couple responses there. Why do you need to understand and estimate healthcare cost? Why do you need to understand and estimate healthcare cost? And you can see Lisa put a couple links to websites in the chat box there. So thank you, Lisa. Let's see what kind of answers we get in. So an important expense that homeowners don't always think when creating spending plans. So you have your spending plan and you really don't think about your health insurance costs when developing your spending plan, but it does play an important part there. Because there's no safety nets in this country, people lose everything because of health insurance. Yep, I think it's 1 in 5 bankruptcies are related to health insurance costs. Yeah. You have to have an idea of what to set aside so you're not blindsided. Absolutely. You need to if you don't qualify for Medicaid, you need to have that money set aside to be able to pay for your health insurance, and understanding your out-of-pocket expenses and applying them to taxes, and budgeting for retirement. So all those are very good answers. A couple of the responses that we have put together, again, is to gain the most benefit from your health insurance coverage. You're paying for your health insurance coverage, so you should take advantage of it and use it to its fullest potential. And so that's an important reason to need to understand and estimate your healthcare costs. And there's some of those costs that don't have any charges, right? So your annual checkup, those kind of things, they don't have a cost associated with them. So you should be taking advantage of that. To determine your total out-of-pocket cost of your health insurance plan, and that's kind of what everyone mentioned earlier. My audio is cutting in and out. Anyone else having trouble with my audio?
Yes.
Okay. All right. We'll see if that's better. You still having problems, or is it better?
It's better.
Okay.
I think it has a little bit to do with your movement.
Okay. We'll turn the mic a little closer here. And the last reason is to have money to pay for your out-of-pocket expenses. So those are the reasons that we, and one more, to determine if your chosen health insurance plan fits your financial situation. So you want to review your cost, and maybe there's a better plan out there that'll cost you less money. So kind of understanding and estimating is an important role in planning and making sure that you have the best plan possible for your situation. So now let's shift to what are the types of healthcare costs. So if you put in the chat box, what are the types of healthcare costs that someone might experience? Surgery, copays, travel for specialty doctors, testing, not covered by insurance and experiential treatment, out-of-network fees when seeking health care while traveling. So some of those, again, all great answers. Some of the answers that we put together are insurance premiums. Again, you're going to pay your premium on a monthly basis. When you go visit a doctor or a dentist or a provider, there's usually a fee associated with that. When you get things such as prescriptions or insulin or over-the-counter medications, there's a cost there. If you're hospitalized, there's a cost with that. Medical aids, devices, and equipment, medical-related travel, and other medical expenses. And so those are all some of the types of healthcare costs that you need to be aware of and then be prepared for in case you have to pay for those expenses. And so here we have a graphic that kind of talks about 3 different types of healthcare costs that you may experience. One is the premium that we mentioned. The other is the deductible, and then you get to the out-of-pocket maximum. And so we're going to play a short little video that'll give you some insight on.
You're deciding which insurance plan to purchase and want to know how much is it going to cost. Well, it's not so simple. Sometimes you pay money toward your health care. Sometimes the insurance company pays money. But when? To figure it all out, there are 3 main ideas you need to know: premiums, deductibles, and out-of-pocket maximum. It may sound complicated, but stay with us. It's not as hard to understand as you think. First, premiums. Think of your insurance as a monthly membership. Every month you pay the same amount in order to be a member. That amount is your premium. With your premium, say $200 a month, you get some preventive care for free. This includes care like vaccines and screening for diabetes, cholesterol, and breast cancer. This care is covered by your premium. But what if you need more than just preventive care? If you need a health service beyond preventive care, illnesses, a broken leg, emergency room visits, you usually need to pay extra. How much? Well, that changes over time. There are 3 main stages. First, you pay. Then, your insurance pays some, and you pay some. And finally, your insurance pays everything. So how does this work? In the first stage, at the beginning of the year, you pay for most of your health care until you reach your deductible. Remember that word? Deductible. A deductible is the amount of money you have to pay for your care before the insurance company will share the costs. So let's say your deductible is $500. That means almost every time you get health services, you will pay for all those services until you've paid a total of $500. It's like you're filling up a bucket. Once you add enough to that bucket so that you pay your whole deductible, then everything changes. Then you enter into the second stage. Now every time you get health services, your insurance company will share the cost of those services. How much? That depends on your plan. Usually, you pay part of the cost, fees called copays or coinsurance, and your insurance pays the rest. But the second stage doesn't go on forever. If you reach a certain amount, you won't have to pay for any services. Remember that bucket? Every time you fill it with copays and coinsurance, your insurance company is keeping track. If you fill that bucket up to the top, everything changes again. You enter stage 3. From this point on, your insurance company pays everything for the rest of the year. That's right, every dollar of your health services paid by your insurance company. So what's at the top of that bucket? It's called your out-of-pocket maximum. This is the most money you will pay for your health care over an entire year. So let's say your out-of-pocket maximum is $2,000. After you pay your $500 deductible, and if you pay an additional $1,500 for various health services, you've hit your out-of-pocket maximum. From then on, you don't pay a penny more for covered healthcare services. It's important to know that every year, this starts over. So next year, you go back to stage 1 and need to meet your deductible yet again. So let's review. You pay a monthly premium to get into the club and get many preventive services free. You pay for other services until you meet your deductible. Then, you and your insurance company share the cost of health services. You pay co-pays or co-insurance, and your insurance pays the rest until you hit your out-of-pocket maximum. After that, your insurance company pays everything. So, how much does your insurance cost? You will at least pay for your monthly premiums, and at most, you will pay for your monthly premiums plus your out-of-pocket maximum. It all depends on the plan you choose and the care that you and your family need. You can get free help from a healthcare.gov assister to choose the plan that's right for your family.
So that video did a nice job explaining those 3 types of costs. So as the video mentioned, the premium, that's what you're going to pay on a monthly basis, usually what we call a fixed cost. And you're going to pay that regardless of whether you use your insurance or not, right? You have to pay your monthly premium. Then you get to that point where the deductible and your deductible is going to vary depending upon your insurance plan, but basically you pay your deductible up to that amount, whether it's $500 or $5,000. Those are costs you'd be responsible for. You'd have to pay those before the insurance started to kick in. And then you get to that point where after the deductible, where you're paying and the insurance company is paying until you get to the out-of-pocket maximum. And then once you hit that out-of-pocket maximum, the insurance company covers everything from that point on. And so now we need to turn into what documents provide information that will help me estimate my healthcare cost. And so I'm going to share a couple of documents where you can get some information about cost. And so the first document would be your health insurance card. And you can see on your health insurance card, a lot of times there's an area where it talks about what your copays would be. You can see that there on the screen. In this particular example, you have the primary care physician copay costs of $15, specialist copays of $25, and emergency room copay of $75. And then you also have a number there for member services, and that's typically listed on your insurance card. And you can always call that number and ask them questions about cost, and they should be able to answer that for you. So there's the copayment amounts. The next place where you can get that information is your evidence of coverage. That's the agreement between you and the insurance company. A lot of times that information is mailed to you, but it can also be found on your health insurance company's website. And that's going to go into detail about how the costs are divvied up and what your responsibilities would be. So that's another place where you'd be able to go to get information about your healthcare cost. And then the third place you can get that is from your explanation of benefit statement. So if you look at the example there, this is, you typically get this on a monthly basis, and it would show you the services that you received. If you look under 2 and 3, you see this, what the service is. 4 talks about the amount billed, and then a breakdown of some other costs as it goes along there. And then you get the 9, 10, and 11, which is your copayment, your deductible, and coinsurance. Then you can see there your total responsibility of 13. So, if you look at this, you can use how you've used insurance to help you estimate your costs moving forward by using the explanation of benefits form. And so now I'm going to turn it over to Maria, who's going to talk about the how.
Right. So how do I estimate my healthcare costs? And when you learn how to do that, you can be a smart user of health insurance. And so really understanding and knowing what your healthcare costs can help you kind of estimate and figure out how much you might need to save, and helps to reduce the number of surprises that you might have when um, you know, have to use your healthcare services. Okay, next slide. So to kind of illustrate all this, we wanted to go through a case study. And this was one of the documents that was emailed to you yesterday by Jesse. So we're going to kind of go through this. And if you happen to have printed out the case study, you can follow along there as well. But so in order to really understand healthcare expenses and determine how much you can save, we're going to use this case study and introduce you to the Perry family. And this case study kind of aligns with one of the other documents that we sent you, and that is the estimating healthcare costs document, which is actually several pages long and is a tool that you can use to estimate healthcare costs. So what we're going to do is kind of use the Perry family as a example and use that estimating costs tool based on the information from the Perry family. So the Perry family has two children, Alex and Lindsay, and you can see their ages there. And the family is a relatively healthy family, and they go to their doctor at least once a year for their annual checkup. And there's no cost for that annual checkup because it's a preventative service. After reviewing the healthcare expenses and the explanation of benefits, those EOBs that Jesse was just talking about, from last year, Perry noticed that the family deductible of $500 was satisfied when each family member visited the doctor 2 additional times. So now that Perry has met the deductible, the only out-of-pocket expenses he has are for co-payments. So the next bullets kind of outline some of the other uses of healthcare services, right? So as we mentioned, each family member visited the primary care physician 3 times, including the annual checkup, and they pay a $15 copay to see the doctor for each visit. And Perry determined he has paid for 6 copays. Alex, one of the children, has allergies, visits the allergy specialist once a year, and has prescription drugs to help manage the allergies. Perry pays $30 for the office visit copay and once a year, and then $9 for prescription drugs 4 times a year. Lindsay wears glasses and goes to the optometrist once a year for a checkup and new glasses, and the specialist copayment is $30 and the glasses cost $100. All 3 go to the dentist 2 times a year, and that copay is $30 for each visit. So Perry pays a total of $144 a month for the health and vision insurance premiums and also the prescription drugs. Perry pays an additional $40 a month for dental insurance premiums. The deductible of $500 a year and an out-of-pocket maximum of $2,000. Perry, although Perry has about $300 in an emergency fund, Perry plans to save for the full deductible. And in the future, Perry would like to work towards having enough savings to cover all of the out-of-pocket maximum. So you can see from this story, right? You can begin to see number of visits, begin to kind of see the story of the family about how they use healthcare services, and can then begin to put numbers against those visits. And I would hope, and I'll just ask you, do you think you could do this for you and yourself and your family? Kind of estimate the number of visits and estimate the number of co-pays that you're paying, and just put yes or no in the chat box. And Jesse's gonna go to the next slide. So this slide comes from that estimating health insurance expenses, or sorry, healthcare costs, a publication, and you can see it's a blank form that gets you to really think about, well, what are my premiums? You know, is there a deductible? Is there an out-of-pocket maximum? And that's sort of the fixed healthcare expenses. They're up at the top, and down at the bottom then are some of those more flexible healthcare costs that are associated with co-pays and numbers of visits, and or you know, dental procedures or vision exams or those kinds of things. So this is a blank version, and this is a tool that you can use to begin to estimate your own healthcare expenses. So next slide, please. Here are the answers for Perry and his family. So health insurance premium was $144 for health insurance and $40 for dental, which makes the total fixed healthcare premium cost of $184. Multiply that by 12, you get $2,208. So that's how much he's paying in premiums. The annual deductible of $500 is listed here, and that out-of-pocket maximum is listed there. And then we begin to plug in numbers for the number of visits for each of the visits and the co-pays associated with that. And so they had 6 visits to the primary care times $15, you get $90. One specialist visit times 30. That's for the allergist. That's a total of 30. Prescription drug cost is 4 times $9 is $36. Let's see, dental visits. They had 6 dental visits at $30, so there's $180 for dental. Let's see, vision, 1 specialist visit at $30 and glasses for $100. So total flexible healthcare costs adds up to $466. So you can see once you kind of get organized and have a good inventory of how you're using healthcare services, you can begin to put numbers on things. All right, next slide. Thank you. Okay, so another item in our that workbook, that estimating healthcare costs workbook, are some what I'm called boxes, right? And so there's some boxes there that ask specific questions and ask you to plug in numbers from your calculations. So you can kind of see that things are color coded. So looking at the sheet, what's the annual deductible? And for this box 1, you've got how much do I need to set aside monthly over and above my premium payments to save for healthcare costs. So in this case, right, we're taking the annual deductible, we're adding it to the total flexible healthcare costs, we're adding those together, and we're calling them the total annual known costs. And you take that number and you put it down here and you divide by 12, and then you get the number of how much over and above the premiums Perry or yourself would need to be setting aside to cover kind of what I would call the expected healthcare costs. Box 3 is, you know, what is the total annual healthcare costs and can I afford this plan? So this is a place where we're starting to take the total annual fixed healthcare costs, so that's all our premiums, right? And our total annual known costs, and we add them together and you begin to get that total out-of-pocket costs. So next slide. Here is how it adds up for Perry and his family. So the deductible was 500. That flexible healthcare cost was 466. Total annual known costs is 966. Divide that by 12. And so Perry should be setting aside about $80.50 extra a month over what he's been paying in premiums to make sure there is money to cover those doctor visits, copays, etc., and the deductible. In terms of total out-of-pocket costs, we have our total annual fixed costs. This is the premium amount, plus those total annual known costs. So totally, Perry is paying $3,174. So can he afford this plan? Well, obviously that depends a little bit on the rest of his financial situation. And choosing, a plan, what we know from the research is many people choose a plan because of the premium. And when there's other out-of-pocket costs, they can really add up. And so there's oftentimes this trade-off, I'll just say, between the premium and those other out-of-pocket costs and the deductible. So oftentimes when the premium is low, the deductible will be higher, and so will those co-payments and co-insurance rates. On the flip side, if you choose a plan that has a higher premium, the deductible can be lower, and those co-payments and co-insurance rates are also lower. So it's sort of like this little balanced teeter-totter type of visual. And so depending on how you use healthcare services and the kinds of services that you're using will really need to drive, do you pick a plan with a low premium, or do you pick one that might be a little higher, but over time, when you begin to add in all of those other out-of-pocket costs, if you add it up, it's actually less money to go with a higher premium and lower other out-of-pocket costs. So it's really important to crunch the numbers and to pay attention to those factors. And so looking back over how you use healthcare services is really an important step in determining which plan is the best, and also kind of figuring out how much to save for those out-of-pocket costs. So next slide, please. So some ways to save, right? Tracking spending to kind of find your spending leaks is a great way to begin to identify some dollars to set aside that could be used for healthcare expenses and other things, other savings goals. Things like avoiding impulse spending and waiting 24 hours is just another great strategy for kind of setting aside money or saving money. The whole idea of comparison shopping, we've learned this as children, and we often do it for, I'll just call it things. We often don't comparison shop for our health insurance or other services that we're purchasing. And so checking out what plans are out there and comparison shopping is an important step. And kind of referring back to one of the previous questions about, what about Medicare supplement plans? You absolutely need to be shopping around between those plans to see what's best for you. Saving loose change, taking a lunch to work and kind of putting what you would have spent on lunch into that change saver or that little piggy bank are great ways to save little bits of money over time that can add up. Borrowing books and videos rather than buying them, paying bills on time to avoid late payments and paying on time. All of those can really help shave some dollars off of our out-of-pocket expenses. Avoiding high interest credit cards and payday lenders. eating out fewer times a month, limiting spending on gifts, and oftentimes that takes some communication amongst family members to kind of all agree that that's the way things are going to go down from now on. And then planning ahead to avoid ATM or bank or phone transfer fees. I find myself, when I go to the supermarket and I do my checkout, that's when I take out a little extra money for the rest of the week. So those are some simple things to do. And then certainly tips for managing healthcare costs. You want to do some of the things that we talked about today. You want to review those health insurance documents to understand what your plan's costs are. And so that is understanding what is the premium, what are the co-pays and co-insurances, and also, what does your plan actually cover? What services are covered and by how much? Estimating your co-payments and your prescriptions and equipment, travel, and other costs, thinking about, how last year was and, what kinds of things, how your family spent healthcare dollars, and trying to estimate them can be very helpful. I'll have to say here, though, how do I want to say this? There are some families who don't have a lot of healthcare costs, and there are others who, maybe there's kids who get hurt a lot, or people who are accident prone, or and so, although looking at last year may not be a great measure or a great way to figure it out. If you kind of look at trends in your family, um, and kind of pay attention to those, and estimate for those as well, that's an important thing to recognize. I have one of those types of people in my family. She's always falling over something, spraining something, hitting something, which tends to mean more urgent care visits. So, just paying attention to that. Okay, calculating how much to set aside over to cover out-of-pocket costs, can be a little tedious, but really important, because then that will help there be no surprises. And then shopping around for that health insurance plan. All of these tips can really help you kind of recognize what your costs are going to be and plan for them, and kind of build them into that spending plan or your savings plan.
Maria, the one question we had that maybe you touch on a little bit, I've always had employee health insurance, but I'm about to go on Medicare with secondary. I'm trying to figure out how this will affect everything.
So, so typically, I'm assuming from this question, Terry, that your secondary is from your employer. And so what will happen is Medicare will become your primary, and your employer health insurance would be your secondary. So there will be a premium for Part B of Medicare, and then you'll have the premium from your employer, and then in addition you'll have a premium for prescription drug coverage, unless your employer is offering prescription drug coverage. Typically your employer, one of the things you'll want to do is look at that secondary coverage to see how it overlaps with Medicare. So in general, Medicare covers 20% of the costs of healthcare services. And so your secondary is typically going to cover, like, the deductible from Medicare, for example, or some of the co-payments or co-insurances that Medicare may charge. The secondary picks up. And so that's one of the things that you want to investigate and have a conversation with your human resources and or the secondary insurance coverage insurer, to make sure that it wraps around Medicare the way you need it to. The other piece that's a little bit different when you move into your Medicare years is that in an employer system, you know, we oftentimes have a plan that covers myself or yourself and family members. And once we get into Medicare, Medicare is sort of on a person by person basis. And so you would have Medicare and your health insurance from your employer would kind of wrap around that. And then your spouse, if there's a spouse, would have a Medicare. And then you would have to see if your health insurance from your employer would also wrap around your spouse, or whether the spouse would have to get their own secondary supplemental or what's called Medigap plan. So I'm happy to spend a little more time with you, Terry, if that would be helpful. And then Kimberly asked, how do you determine healthcare costs for your retirement? Well, I think I answered some of that. There's going to be different kinds of premiums, but are different because you'll have multiple insurance plans, you'll have multiple premiums, but you know, it's no secret. You can go on the Medicare.gov website, no matter how old you are, and begin to look at both what will Medicare cost you in terms of that Part B premium, but also what options you have in terms of prescription drug and Medicare supplement insurance policies will cost you. So you can start investigating now and really begin to look at that and investigate that. And if you have the option to have a medical savings account or a health savings account that allows you to put money away now for when you retire, and you can use that money when you retire to help offset some of those costs. So Jesse has reminded me that, you know, here are some reliable resources from the internet. That includes our University of Maryland Health Insurance Literacy website. Lots of great consumer resources there. I mentioned the Medicare.gov website. The IRS has a great publication 502 that really speaks to kind of the tax and healthcare cost side of things. The Kaiser Family Foundation has some good resources as well. And then healthcare.gov is where we got a lot of our resources regarding kind of the terms and information.
Glenn asked, do you still have to pay the full co-payment after hitting the deductible?
So that answer is yes.
And then Kimberly asked, I know there's an FSA and an HSA associated with health insurance. Which one can be carried over to another year? And is there a way to enroll without getting a high deductible plan?
So we do have a publication on our health insurance, on the Maryland Health Insurance website that speaks to the difference between FSA and HSA. So a flexible spending account is something that your employer puts in place. You can put money in there pre-tax. It is an IRS rule that money does not roll over from year to year to year to year. There is a rule that allows a certain amount of money to be able to roll over until March 15th of the year after you signed up, I'll just say. So there is money that could roll over until March 15th and used. So that's how an FSA works. A health savings account is typically owned by you as opposed to the employer, right? It allows you to carry money over from year to year, but at this point, those are only associated with high deductible plans. There are such things as medical savings accounts. Those are typically associated with people who are self-employed, and those follow some of the same rules as those health savings accounts do. So again, that IRS publication is a great place to go for more information about that.
Yolanda, let me find it here. Would it be wise to say that we would probably want to do a cost estimate around the annual enrollment period, since costs mostly change yearly? And so then yeah, that's her question.
So would it be wise? Well, it's always wise to do a cost estimate, but then, you know, we're money people, so of course we're going to tell you that. And around annual enrollment is a great time, because that's when you can begin to, you know, that's when we're paying attention to the costs. That's when we see when the premium changes, or the co-pays, or the insurances change. And if you kind of look back at how you used your plan last year, it's a great time to kind of look at, you know, kind of crunch the numbers with the new numbers, I'll just say, and that can help you figure out, for example, well, how much might you put into an FSA, or how much do I need to set aside each month so I have it. So you're right on target there, Yolanda. I often do that when it's FSA re-enrollment time for me. I typically look back at last year's and how much out of pocket over and above the premiums, and then kind of make an estimate for how much I should put in my FSA account and or my savings account. So in terms of the survey, if you had opened the survey up and done the pre, if you just keep scrolling down, right, you should be able to do the post. And if for some reason you didn't do the pre, we would certainly love for you to fill out the post anyway. So Lisa has put the Qualtrics survey URL in the chat box again. And so you can click there and be off to do the survey. And of course, we want to thank all those folks from the University of Maryland Extension and their College of Ag and Natural Resources, and my University of Delaware Cooperative Extension for all the work that we've done to do this program and all the other Smart Choice and Smart Use programs.